what has to interest you, no matter the time it is talked about. And so this morning we want to have a look at very important issue, the issue of family planning. So many people believe in family planning. Some people say they have not heard about it. Some people say they know about it. But before we start this program this morning, I would like us to take a look at some samples, some opinions of some few people we were able to get to say something about family planning. My name is Grace Hussein, welcoming you to this bit of the program. When we get back, I'm going to introduce you to my guests in the studio. Let's see what the people have as their views concerning family planning. Welcome on board.
Okay, Emmanuel Esoko is my name. I think I know a bit about family planning. How we want to say about it, it is what enhances us to know how to put together our children, like child spacing as a case may be. My take for family planning is that I vote it's ideal. My reason is that looking at the economic situation of the country now, we don't need to give birth to those numbers of children like our foreparents did, so that we can gather for them. Aside that, it will also, like I often say, it helps in child planning and child spacing. It will enhance you to know the interval of years you need to give birth after you might have already given birth to the first or the second child, as the case may be. So I want to encourage all our parents, potential and prospective parents like my humble self, to initiate and also give a thought to family planning. It will help us to give birth to healthy children at the end of the day. So
yeah, I know family planning, Sha. Family planning has disadvantage and advantage. For me, I support it, and I also don't support it because one, it helps in reducing the rate of, where I support it, help in reducing the rate of childbirth. Why I don't support it is because one, family planning, when you take it reach a certain point, it stops a woman's menstruation. You really see that woman's menstruation will not be frequent. So if there's any way for people who are doing the family planning to improve on that aspect of making sure that after you take the family planning, your menstrual period will be flowing normal as it's supposed to be, then I will support it. But the aspect of not, after taking the family planning and you find out your menstrual period is not flowing, I don't support that aspect. But it's good because it stops the rate of childbirth, because Nigeria now is hard to feed even 3 or 4 children. It's very hard now. So family planning help to stop people giving birth anyhow. So that's my own.
Okay, please.
Okay, family planning is, my little understanding, is a way of trying to curtail the excess that could be resulted in the partnership of husband and wife, and that way it will enable some kind of regulation that will make people to be aware that, okay, the population in a society is not really a good thing. So I believe if one can actually adhere to family planning, you have a lot of things to actually plan very well for, and at the long run you have a society that is not overpopulated. With the rising economic situation, I think family planning is a good idea if people can adhere to it and then give in their best without sidelining the benefits and other factors. But among some of the things that I think could be a problem is health challenge, which may result as a result of the various drugs and some other.
Okay. Right. I've heard of family planning. Yeah, I do support family planning. The benefit of family planning is that it helps parents at least be able to train their children to any level they want them to go in life. So that's just
Yeah, thank you very much. That's all we could take this morning to sample the opinions of our young people, what they think about family planning and what benefits they stand to derive from it, and those were their opinions. And so this morning, to join me talk about the benefit of family planning is Priscilla Acholono. I hope I got that right. Acholono. Cholono.
Yeah.
Okay, Priscilla Acholono. Welcome.
Thank you
And
so much.
Priscilla is a technical support lead, demand generation with the Challenge Initiative, Akwa Ibom State. I'm glad to have you here with me. I also have here in the studio Nsidebe Johnson, the Assistant State Health Promotion Officer, Akwa Ibom State Ministry of Health. Good to have you here, Nsidebe.
Thank you.
How are you today?
I'm fine.
Good to be here. Okay. Yes, this morning we are talking about the benefit of family planning. I don't know why you got so involved in family planning advocacy. Can you maybe let's just start from there. What took you to talk about or advocate for family planning?
Okay, thank you very much. So we understand the importance of life, and we know that one of the things that make us to stay alive and healthy is our reproductive health. And family planning is one key part of our reproductive health. And because a lot of women are prone to, issues around reproduction, because they are the ones that bring forth babies into the world. You see statistics giving us figures of the number of women who die as a result of reproductive health related issues. And because we know how important women are to the society and to the world at large, and especially when it comes to bringing forth, so we decided to go into it.
I was talking about you personally. Why you entered there?
Oh, really?
Yeah.
Okay, as a person.
Yes, as a person.
Oh wow, thank you so much. I have this passion for women. And most times when I see women having a lot of issues around them, a woman not looking so good, a woman not being able to take care of herself, a woman having a lot of issues on her head, and when you check around it, you see that it's either as a result of having too many children, or like too frequent births. And when I see that, I always feel empathic about them. And so because I want to contribute to making sure women live healthier lives by knowing what they need to do to stay healthy, especially as regards to their reproductive health, that's why I decided to go into family planning in the first place.
That's good. Okay. I don't need to ask you about that. Let's just go into the discussion of the day. Let's establish what family planning is. I think you can start with that.
Okay. Thank you so much for the question. When we talk about family planning is the ability of an individual or couple to decide the number of children she wants, the number of children she desired, and how many and how she wants to space the children. In a nutshell, family planning is having children by choice, not by chance.
Okay.
Yes.
I love that. There's something I think is not clear to me. You were saying she. I think, is it one person or is it both?
It's both couples.
Okay.
Yes, couples.
Okay. I don't know if you have anything to add there.
Yeah. So family planning, most times people have this misconception about what family planning is. It's actually very simple. It is what makes you, or when you decide to, when a pregnancy should come, when you decide that, okay, I am due for conception, this is the time I need a baby, this is the time I don't need a baby, and also I don't want to have babies when I am not ready. So it's just a simple thing where an individual or a group of persons, because people who are not married also are supposed to go for childbirth spacing, like family planning. So you are planning your family even before you get married. You plan your family when you are in marriage as a couple. So it is expected that an individual, a man or a woman, before marriage should plan. And then when you are married, a man and a woman should also plan to decide when they are ready for babies, and then when they are not ready for babies, and at the time, the number of babies they intend to have, and then the period at which they plan to space the births.
Okay. What are the key actions there? I think I've heard you talk about child spacing. What other thing are the things? I just want people to really understand. Maybe as you were saying it, they may not really understand it well. Child spacing, and when they must have the baby. Is that it?
Okay. Yeah. So it's like preventing pregnancy.
Okay.
Prevention of unplanned pregnancy. I think that's in the lowest term I can come to.
Okay.
So when you, especially when you know, for instance, someone who is not married, you know you're sexually active, and definitely pregnancy should come, especially if it's not maybe you are not using family planning, so pregnancy should come. And because you may not be necessarily ready for that pregnancy, it will definitely affect one or two areas of your life. So you plan to prevent so prevention of unintended is the appropriate word, but most times when you use unintended, people don't really understand. So unplanned, when pregnancy that you are not ready for. I think that's what it is.
Okay, I will stay with you before we go into looking at other aspects of family planning, what we do to even plan this unplanned pregnancy. Let's take a look at statistics, maybe talk about the mortality rate. Maybe if we know why we should take family planning, it will help us to go a long way. So let's have some sort of statistics, let's have some understanding of how it is, access to it, mortality rate, either of the mothers or children and all that. Let's have that.
All right, thank you very much. In Akwa Ibom, we have over 1.4 million women of reproductive age. So what I mean by women of reproductive age is women who are up to the age of giving birth. Yeah. So out of this,
from what age is that?
We have from age 15 is the official age, but we all know that going by the realities, we have children of 12 years who give birth. Okay. Yes, so but officially it's from age 15.
Okay.
But in reality, it's even from age 9 or 10. We've seen a child of 10.
As long as the child starts having
sexually active.
Okay.
Yes. No, some don't even start having menses before they get pregnant. Yes.
Okay.
Yeah.
All right.
And so out of this over 1.4 million women of reproductive age, we have just 19.8%, that's according to the NDHIS 2018, of women who access contraceptives, who take up family planning services. So just imagine 19.8% of this over 1.4 million women. So a lot of women don't have access, even though they need. So they're like hanging fruits. There are women who are eligible for it, but they don't go for it. They are not on any family planning contraceptives, and because of that, there's what we have, which we call maternal mortality, and then out of 512,000 births, we have out of 100,000 births, we have about 512 women who die as a result of pregnancy complications, some hemorrhage, some just pregnancy and delivery, childbirth related deaths.
And how is this related to family planning we're talking about?
That is because in most cases a woman is supposed to have, because we have 3 major reasons why women lose their lives. One is too early births. Okay. So if a child of, you can imagine a child of 9 years, a child of 10 years is to give birth, her pelvic bones are not mature enough to carry the weight of the baby, and that is why most times it results to early, you see young persons dying while giving birth, and then low birth weight of babies, and then neonatal mortality. And so that is one of the reasons why women die.
Neonatal, that's the one the child died.
Yes, at birth.
When you speak, bring it down for the people to understand.
All right, I'll try. All right, so one of the reasons why women die as a result of without giving birth is too early births, like I've mentioned. Then the next one is too frequent. So too frequent is, I am pregnant today, I give birth in 9 months time, and then 3 months later or 2 months later I'm pregnant with another baby, and then so it keeps going like that on and on. You see that it's just like our womb. You see, when a woman gets pregnant, the stomach enlarges, and then when she gives birth, it gets back. So it's just like an elastic. When it stretches, and it gets to a certain limit that it stretches no more. And what happens is it breaks down. So that is what happens, and that is why most times it results to a woman having hemorrhaging after childbirth, and which could lead to bleeding. Yes. Which most times, leads to the woman losing her life.
Okay.
And the third one is late births. So you see, some women start having births early, and then they keep going and going until they are 50 years, 50 plus. They are still having children. So these are the reasons why women die. And because of this death, one of the major reasons that we could reduce this death among women is through family planning, because it helps you to plan pregnancies. So after each birth, you can stay for up to 2 to 3 years before you go again for the next pregnancy, and then it makes the womb to get back to normal. It heals, and then it gets strong for a woman to go again, and then limited children to prevent. So that is why we are encouraging family planning for every woman and man within the ages of reproduction.
Okay, let me go to Nsidebe. Nsidebe, we have talked about the essence of family planning. Now let's take a look at what is needed to do family planning.
When we talk of family planning, it needs a lot, because as a family, you need to sit down, plan for it. So a woman will consider, the couple has to consider so many things, like maybe their financial aspect of it, consider the timing, as it has already been said, the space between each child, so that they will be able to take care of themselves. They will also consider the little ones they have.
Okay.
Because
so let's talk about the contraceptive. Do we have types?
Yes, we have types.
Okay.
We have
Can
different
you
methods. We have IUCD, intrauterine, the contraceptive device. That one is inserted into the uterus. We have the pills, the oral pills. Those ones are like tablets, whereby you take it on daily basis. You have the calendar method, whereby you use calendar to count from the time.
Okay, that's a natural method.
Natural method.
Okay, in case somebody doesn't take this ones, he can use
yes,
that. Okay.
can use that one. We have the implant, whereby it is inserted at the upper arm, the implant. Then we also have the billing method. So we have other methods a woman can choose from.
Okay. Okay. Priscilla, do you have any to add there?
Yes, yes, sure I have. We have they are categorized into natural, hormonal, and permanent methods. Okay, so she has mentioned some of the both hormonal and natural. Hormonal, natural, and then so for the natural, the ones some other ones for natural, she has mentioned the billing method, and then so that billing method, it's like a woman knowing her cycle. So you are able to calculate your cycle, know that okay, I'm a 26-day cycle, I'm a 28-day cycle, and this is the time I am safe, this is my safe period, and this is the period I'm ovulating. So that's the natural. And so we have billings, we also have the cycle bid, which helps a woman to calculate her cycle. Then we have for the hormonals, she mentioned the implants, and then we have the Jadel as well. So implants is a 3-year contraceptives, and then Jadel is 5 years contraceptives. And then we also have the pills. We have pills for breastfeeding mothers, and then we have pills for women who are not breastfeeding. Okay, so we also have injectables. We have the 3 months, we have Cyanopress, we have Depo-Provera, we have Noristerat, and Microgynon, which is a 1 month. So 1 month is Microgynon, 2 months is Noristerat, 3 months is Depo-Provera, and then the self-inject is Cyanopress, which a woman can be taught how to self-inject. So after being initiated at the health facility, she could go home, and then she'll be given some doses for her to be able to inject all by herself if she does not necessarily need to go get to the facility.
Okay.
Yes, and then for the permanent methods, we have the vasectomy for the men, and then tubal ligation for the women. But most times, we don't even go there as Africans, and especially as Nigerians. When those permanent methods are mentioned to women and men, they're like, no, these are no-go areas. Because, the misconception there is they feel if a man goes for vasectomy, he won't be able to perform his, manly so these are the methods that we have that are available.
Okay. You still have something?
Yes, I still have something to add, because we have the condoms, and that is the only method that prevents sexually transmitted disease. We have the male condom and the female condom.
Okay.
Yeah,
so
and
if you also want to do family planning, you can use that method. But I know that is not 100%. So is there any that is 100%?
It's 99%, and so the other part that does not make up the 100% is human error.
Okay.
As humans, the usage is what determines the efficacy and how well it works.
Okay.
Yeah. So human error could make it not to work like 100% as it is. So it is 99.
For one to get knowledge of how to go about family planning, where can people go to? Now you have mentioned even the natural methods. Not everybody will understand it. If I get to the health facility, can I be taught how to do it and other forms of contraceptive?
Absolutely, yes. So what the family planning providers do at the health facilities, and that is why we always encourage that everyone should please go to the health care facilities for family planning services. Don't just go to like a PPMV, please, because it's something that is very sensitive and it has to do with your health. And so when you get to the health facility, we have well-trained providers who know what to do. So first of all, they take your health history, and with conversations, and they check your weight. They know some different information that will help them to determine, or together will be able to make your informed choice on what method will be suitable for you.
Okay.
Yeah. So the healthcare provider does not just stop there. There's what we call balanced counseling that the providers do. So they take each client through what each method works, how each method works,
Okay.
and then what they should expect, like possible side effects, and then what is myth and what is not true about the method they may have decided to go for.
So I don't just walk into the facility and say I want this particular one. But I know that sometimes some people can just walk into a health facility and say this is what I want, even when they are counseled that this is not. And what do you think about that? Don't they have the right to choose what they want?
Absolutely, they have, and that is what I'm saying. It is they guide you to make an informed choice. Most times people walk to the facility, like you rightly said, because if a friend, maybe we are friends, and then we get discussing, and I get to find out that you took up maybe an IUD,
and it's working
for you. So I go with that mindset that IUD is the perfect one, and that is what I should go for. I get there and they tell the provider, please, this is what I want, because my friend is. But it doesn't work that way, because what may be good for you may not be perfect for me.
Okay.
Because our systems differ.
Okay.
And so the healthcare provider takes time to put you through, and then with the health history too, will be able to determine which FP method will be suitable for you. So you are expected to make your choice.
Okay.
But if the choice is maybe contrary to your health,
depending on the history.
Okay. So the provider will tell you this and this and this are the risk factors if we go ahead with this. So they also have a MEG-WIL, eligibility criteria that is being used for each health history that is obtained from each client before they can provide the service.
Okay. You wanted to say something?
Yes, that was what I wanted to say, because even if you have the pre-knowledge of that family planning method that you are going there for, you'll still be counseled on different types. And also, the family planning provider is going to counsel you on the methods apart from the one you choose, also use the will, we call it a eligibility criteria. She has said
already
to council.
that.
She has
Okay.
mentioned that.
Okay, let's move on. We say we are talking about the benefits of family planning. So let's just quickly run over the benefit, because if I know the benefit, maybe I will I will take a decision today to opt for it. So let's look at the benefit. Let's start with you.
Okay. Let me start with the overall benefit to the society.
Okay.
Family planning is very beneficial to the society because, one, it will help the government. Now everyone is almost like poverty, we are crying, no food, no basic amenities, we don't have electricity. So family planning would help the government to do is they will be able, if the population is not alarming, they'll be able to have more health care facilities, and even in the healthcare facilities they will be more equipped. So now, if for instance you go to a particular health facility, you see that the population, the crowd there is too much, and beds is even a problem. Secondly, schools, you go to schools, you see population of children in a class. And then thirdly, you go to let's say transformer that is supposed to carry maybe 500 building capacity
As infrastructure now.
infrastructure, exactly. And so if we have like over 1,000, we all definitely know that it just definitely won't carry. And so to generally to the society, family planning will help manage our population, and when the population is managed, food will be sufficient, healthcare will be will be more of more quality, education will be of more quality, because when a teacher teaches up to 90 students, 90 children in a class.
90. Have you gone to some of our public schools? Do you have an
idea?
idea?
Not really.
Okay.
Okay, so you can imagine one teacher to 90 students in the class. The teacher will be overwhelmed, and the best of him or her will not come out, and the children will end up not getting the best of education.
I'm imagining having 90 children in a class.
You can imagine.
To even speak for all of them, especially at the back, you need a microphone.
Definitely.
And there is none in our public school.
Definitely.
And even when we were, will I say maybe about 30 in a class, children will still be making noise.
Exactly.
So if you have up to 90, okay, let me allow you continue. Okay.
All right. So when we plan our families, the number of children that will come out per family will be reduced, and then the quality of everything will be better than what we currently have.
Okay. Ideally, the spacing should be like how?
The spacing is expected to be from 2 and 2 years and above.
So when my child is up to 2, I can now.
You can go
in
for
again.
the next
Okay.
next
Okay,
baby.
at least 2
2
years
years and above.
is better.
Yes.
Okay.
That's
Yes. I'll still come to you because I know the benefits are enormous.
Yes.
So let me have you say some of the benefits that you have.
So, for the benefit of family planning, I will now take on the mothers. So the women now. The women will now have time to take care of themselves. Will now have time to take care of the babies, give attention to the husband. Apart from that, because of too many children, for the women that have delivered up to 5 times, the possibility of them having a pregnancy and childbirth complications is there. So with the family planning, there will be these complications, pregnancy complications will be reduced to the barest minimum. And another thing is that they will be able to breastfeed the baby, provide for the baby. These children now will have good nutrition. They will not be competing for food in the family. Yes, because when you have enough, children, maybe like 5-6 children now, the children will start competing for food in the family, and the woman will not be emotionally stable. But because she has planned for this pregnancy, she has planned for this baby, she is now physically fit, she is now emotionally stable, and she can plan for other things. Yes, that is it. And the attention to the husband, as I said before,
which is very important.
Very, very
They need it so
important.
much.
Yes.
Okay, I remember, I think, was it last week, we went to Otioro in Okobo local government area, and we saw a couple in their middle age. I think the husband was 35, while the wife was 34 years, and they were assessing family planning. You know, what interests me was the fact that they went there, and I think that was their 6th child. That was their 6th child, and so they went to assess family planning, because if they don't do it, they may still have to be having children. And we saw the spacing between these 6 children wasn't really good. So I'd like you to use that to talk about how family planning can alleviate poverty.
All right. We know what the current economic situation is in the country. And, you know, there was one picture I came across, and it really made me laugh, where a tuber of yam was segmented into 7. Okay. And so that each segment is to save for each day. So it's to save as...
I hope the tuber of yam was really very big.
It wasn't even so big. So you can imagine, like you already said, a family of 6 having just this tuber of yam, and then a little part of it is supposed to be enough for everyone in the house, which is not possible. So if we have much more than we can take care of, definitely poverty is inevitable. It is inevitable. You cannot avoid it. I have 2 children, and I work, my husband works, yet we know what it takes, like how much we work to make sure that we take care of just these 2. And I just wonder, what if we had more than, or we even had up to 6, like, you know, you mentioned this family. So for when it comes to poverty, if you have more than the ones you can take care of, the truth is you definitely, no matter how much you have, except you are maybe like a very like Dangote and the likes, you know, who may not necessarily be affected by. But if you are not like them, definitely you need to cater for your children's school fees. Feeding is there, and we know how much is a cup of gari. It's about 250 naira. I think 2.5 cups now is 500 naira. So imagine if an individual can even consume up to 2.5 cups. You can imagine how much, or the quantity of gari that should be able to serve a family of 6. And then mother and father not inclusive. Okay. So the 6 are just the children. So poverty. And then when you talk about school, you will not be able to afford quality education for them. And if the children don't go to school, don't get quality, because this is what parents owe their children. If they don't get it, that's where we have issues around. You see, Skolombo boys, and we have all these dropouts, school dropouts, children on the street, hawking, and you know, and so, and again, these are threats to the society, because if they don't have food to eat, when they see you as beautiful as you look, they feel, oh, she has so much, you know. Madam Hussein has so much, Madam Grace has so much. So I think if I go to steal from her, I should also be able to feed. So you'll be sleeping at night, and before you know it, you have people who will come to rob your house. And so we don't have peace because of this. So this is what, you know, family planning, lack of family planning could cause. Poverty and insecurity, a lot.
Okay, before we go, because I think we need to round off quickly. I'd like you to retrace some things you would love to say about family planning. Sell it to the people. Let them be able to buy it.
I want to let them know that family planning is voluntary.
Okay.
It's voluntary because nobody chooses for you. You make your own choice. And forget about the myths and the misconceptions surrounding family planning. It is true that family planning helps to prevent unwanted pregnancy or unintended pregnancy. It protects women from complications from STDs, that is sexually transmitted diseases. So I encourage women to access family planning in order to reduce the mortality rate.
When you mean mortality, the death rate.
The death rate.
Thank you
of
very
the
much.
population.
Okay, Priscilla?
All right, thank you so much once again. What I would tell the men and the women is that life is not just about having so many children. You should be able to take care of yourself. You should be able to train the ones you have given birth to. You should be able to at least have something to do to contribute meaningfully to the society. If you have much more than you can take care of, absolutely this won't be possible. You won't be able to take care of yourself. You won't look good. Your health will be in shambles, and so family planning is something that everyone needs to embrace. The man, the woman, adolescents, young persons, everyone should embrace family planning services. And again, women, March 8th, that's Friday, is International Women's Day.
Yes.
Yeah, and so please take advantage of this day. We are having free family planning services in some designated, especially, okay, we are going to, for this year, we decided to go to Etinan,
Okay.
Etinan local government.
So the General Hospital Etinan?
No, it's Ntiaoro community. So we are going to have kind of an outreach there where a lot of women will be able to access family planning services. So please, if you're around there, come. There are free family planning services for you, the man and the woman.
Yes, I had forgotten to ask about the cost of family planning, but I hope in all other places family planning is free. Is it free?
Family planning commodities in itself is, or in themselves, are free, completely free. But again, we have at the facility level, there are what we call commodities, consumables that need to be used to offer these family planning services. So, and then in most cases, healthcare facilities don't get these consumables provided. And because of that, and then some cards and some like a pregnancy test and the rest, so you may be asked to give just a little.
So where does the government come in?
This is exactly where the government should come in.
Okay, I think we will get you back to talk about some of these things because we don't have time again to talk about that today. I intended opening the phone line, but I saw that you people had so much to offer us and we didn't need to even open the phone line. So next time you come, or any of you should be here, we should be able to talk about what is happening.